This is an instructional video for the MAPIT CRT clinical trial being coordinated out at the University of Calgary, Living Cardiovascular Institute. This video will take you through how to use the interactive web-based navigational model for placing the left and right ventricular leads for CRT. This model is only displayed for patients that have been randomized to model-guided therapy and is only accessible to unblinded investigators. The model will be displayed in your web browser in a default view, which is the anterior-posterior view. The potential left ventricular targets have been displayed in red and right ventricular targets in blue. These have been ranked according to both scar and asynchrony measures, as well as interlead distance. The right ventricular lead target has been indicated by a blue sphere, the left ventricular target by a red sphere. The color gradation that you see in the segments is based on the amount of scar content as displayed in the lower left-hand corner. To move from the standard AP view into standard fluoroscopic views, you can use the buttons in the upper left. Here we click on LEO 30 and we can add 30 of caudal. In this view, you can see that the left ventricular target is at a 2 o'clock position. If we cannot find a coronary vein branch that matches the 2 o'clock position, then you can move to Plan B by selecting plans on the right-hand side. If you cannot achieve Plan B, then we ask you to move to Standard Care. We're going to now go back to the standard AP position. An alternate way to get to a more custom fluoroscopic position is to use these slider bars. We can go in a caudal position or a cranial position. We can go in an REO position or an LEO position. We can also do other things such as zoom in and out. I'm going to put back to an REO 15 position and add a long axis view. The MRI images were added when you accessed the web browser and the model was loaded. You can see here that by zooming out and moving the heart model around, we can get a better representation of where your targets are relative to anatomic structures. For example, the tricuspid valve leaflets are shown here. Our RV target is quite distal. If you want to use the tricuspid valve leaflets as a reference, it may assist you in positioning a more basal RV pacing position. Similarly, if we were to go into an LEO caudal position, we may want to apply the short axis view. By doing this, it allows you to see where the right ventricular outflow tract is, and in the less frequent prescription of a basal anteroseptal position, can allow you to judge where you are relative to the right ventricular outflow tract. I will now turn the MRI images off and go back to the default view. If you have any questions or concerns about the use of the model or its functionality, please do not hesitate to contact the local study coordinator at your site or the main study coordinator at the University of Calgary, Michelle Seib. Thank you.